Hello, and thank you for joining us for TGH Ask an Expert, a live Q&A series. I'm your moderator, Karen Loftus, joined by Dr. Cheryl Godcharles, Assistant Professor at the USF Department of Obstetrics and Gynecology, and Amy Reinke, Director of Midwifery and Inpatient Care, also at the USF Department of Obstetrics and Gynecology. Thank you both so much for being here today.
Thank you for having us.
Yeah, thanks for having us. We're excited to be here.
Okay, it is World Breastfeeding Week, and that is why we are here today. We have a few housekeeping notes before we get into the bulk of our discussion. If you have any questions as we go along, please place them in the comments section, whether you're watching on YouTube or Facebook. We will get to as many of those as time allows. Plus, we have several wonderful pre-submitted questions that we're going to get to as well. As a reminder, yes, Dr. Godcharles and Amy are professionals. Please always consult a primary care provider for individualized medical advice. Okay, as I mentioned, it is World Breastfeeding Week. Let's get started with you, Amy. Why is this topic so important for mothers and mothers to be?
Yeah, so the theme this year for World Breastfeeding Week is investing in breastfeeding and investing in your future. So we are looking at the need to build long-term and equitable support for breastfeeding mothers through sustainable systems. So you might ask, what does that look like? So this means that every mother deserves access to the support and information she needs to breastfeed for as long as she wishes to do so. I also wanted to start by saying that depending on what type of professional you talk to regarding breastfeeding, you might hear differing opinions on things, which is okay. Remember that you are your baby's mom and only you. And so at the end of the day, you're the one making the best decision for your family. And so just like trust that instinct, because it can be really overwhelming when you're hearing lots of different opinions. And then one final thing is I just wanted to start before we start answering all of these good questions by saying that we want to acknowledge that the topic of breastfeeding can be triggering for some of you guys. For some moms, it comes really naturally and it's easy. But for the majority of women, it actually can be quite hard and isolating sometimes. So we see you, and that's why Dr. Godcharles and I went into this specialty. We believe in the benefits of breastfeeding for the mom and baby dyad, but we also realize that like every single woman needs support. So yeah, we're excited to answer some questions.
Wonderful. Thank you so much, Amy. Let's get right into our first pre-submitted questions. The question is, how do you prevent and treat clogged milk ducts? We'll go with you, Dr. Godcharles.
So preventing and treating clogged milk ducts is something that's been sort of debated and maybe misunderstood for many years. More recently, we found that most of the time the clogs in milk ducts are coming actually from external pressure on the ducts or swelling in the breast. And so treating the breast swelling like you would treat swelling in any other gland is really important. So ice, Tylenol, ibuprofen, continue to feed on demand. We're not trying to work a clog through a tube like we used to think. So no aggressive massage. We're not trying to overpump or overfeed. It's really about reducing swelling. So just continuing to feed baby on demand and treating the breast gently.
Okay, let's go on to our second pre-submitted question. Thank you so much for that answer. How do you maintain a good milk supply as your baby starts solid food at 6 months? Amy, you want this one?
Yeah, sure. I like how Dr. Godcharles said treating the breast gently. I think that can go a lot of ways. But yeah, really it's supply and demand. And so when you do start solids, your body's going to adjust. And I do like the phrase that food before one is just really for fun. And I think that we can start introducing foods, but our babies still need breast milk. And so continue nursing on demand or whatever like system routine has worked for you well in the past for those first 6 months. Continue doing that. If you're wanting more like a specific answer, I would say prioritize breastfeeding in the morning and night. Prioritize those feedings to be really good feedings. That's when babies typically want to be more cuddly, doing skin to skin. It's a slower time of day, so they're less distracted, which we all know at 6 months, they want to be on the go, that kind of thing. And then that's also maybe a time that you can utilize some of your pumped milk in the freezer for supplementation if you needed to do that. But I think just the thing to remember is that the more you put your baby to the breast, then hopefully the more milk that your brain and body is going to produce. So,
yeah, it's also important to remember that as a baby takes in more solid foods, their milk needs are going to slowly decrease, especially closer to a year old. And so asking your baby's care provider how much milk the baby should be getting so that you can reassure yourself, maybe your supply is dipping some, but that may be natural.
Yeah. Yep.
Okay, great answers. I also want to remind everybody who's watching, if you do have any questions, we are going to take live questions as well, if we can get to those as time allows. So put those in the chat, whether you're watching on YouTube or Facebook, and we'll try to get to those as time allows. For now, though, let's get to another pre-submitted question. Dr. Godcharles, this one's for you. Do you have any unconventional tips to increase milk supply?
Unfortunately, there are no magic ways to increase milk supply. The most effective way to increase milk supply is to remove milk more frequently. So either feeding the baby more frequently or extracting milk via hand expression or pumping, and just adding in 1 or 2 more extractions a day can help increase supply. Other things that can help are things like adequate nutrition, sleep, hydration, reducing stress. And if your supply is still low, definitely seeking somebody to talk about why that might be and how we can help.
Okay, so you mentioned nutrition, which leads us perfectly into our next pre-submitted question. We have a question here. They're asking for tips about getting adequate sleep, water, and nutrition while breastfeeding, especially in the midst of caring for newborn twins. She says, I didn't get to breastfeed them as long as I would have liked, so I want to be better equipped for the future. Amy, you want to take this one?
Yeah, I think I'll just echo what Dr. Godcharles said. But first I would say, give yourself grace. Twins is a lot. And we definitely believe that you can breastfeed twins, but just first off, taking care of yourself. So getting into a good routine of hydration, really remembering to bring your water like everywhere, maybe adding some electrolytes. There is no secret electrolyte though that you can drink to increase your milk supply. But just, focusing on hydration, snacking more, focusing on protein. It's hard, especially when you have twins, to be able to get enough calories in throughout the day. So I would say even at night, like when you're doing those night feedings, like having a bar or something, or a banana or something by your bed to be able to eat when you're up nursing. And then, just the more that you're putting baby to breast, the more milk you might make, but really just giving yourself grace, because it's a lot.
And don't be afraid to ask for help. If you have people who are home with you, you may tell them, hey, I'm in charge of feeding these 2 newborns. I need you to be in charge of making sure that I'm fed and that I'm hydrated.
Yes.
And delegate those tasks.
Mm-hmm.
Yeah, that's a great point. Yeah. So that's some great information about nutrition that we've touched on already, and milk supply. We have a couple pre-submitted questions now about latching. So this one's for you also, Amy. If your baby hasn't latched well in 6 months, they ask, is it too late or should we keep trying?
Yeah, that's an excellent question, honestly, and one that I get a lot actually in clinic. No, absolutely not. It is not too late. You can always seek support with latching at any time. I think honestly, there's many instances at birth or in the first few months of a baby's life where direct breastfeeding might not actually be happening for numerous reasons. Maybe baby's in the NICU, or who knows why, but maybe for a mom's mental health or physical health, it's actually just better to be pumping and giving baby milk that way. So there's so many reasons why someone might not latch the first 6 months, and it is possible to latch after that. I think the best thing to do would be to reach out to an IBCLC or one of us at USF, and bring your baby to the visit when typically they might want to nurse or are hungry, so that we can like really sit down with you and assess kind of what's going on, how they're latching or how they're not latching. But really you need support to be able to do that. So make an appointment.
Yeah, that's great. And we have something in the comments, not a question, but we had a nice comment that somebody added. They say, this is so great. I wish I had this when I was breastfeeding my kids. So the information is being well received already. All right, we have another question about latching.
Okay.
Dr. Godcharles, this one's going to go to you. What resources do you have to learn more about latching?
Well, at Tampa General, we have all of our nurses go through extensive training in supporting breastfeeding, and a large component of that is positioning and latching. So all of our nurses on the labor floor and the postpartum floor can definitely help assess and assist with latch. We also have a large lactation team at the hospital that can help with latch. But once you go home, the best resource is to reach out to a community lactation consultant or to see your primary provider, whether that's an OB, a midwife, family med, to get some help with latching. And like Amy said, definitely bring your baby to that appointment.
Yeah, that's a great point. Again, a reminder, thank you all so much for joining live to tune into this amazing episode on the breastfeeding support and awareness. If you have a question, feel free to drop it in the chat on YouTube or on Facebook, whichever platform you're watching. We have a couple questions coming up about pumping. So This one's for you, Dr. Godcharles. What are your favorite portable pumps? And then maybe what's your advice about pumps in general?
So pumps are definitely a tool that has made breastfeeding easier, but also harder. There are a few main kinds of portable pumps. One is the wearable that fit in the bra. There are some that are wireless. There are some that plug to a little device that you wear on your hip. And those can be great for certain situations. We have a lot of people on our unit who wear those while they're working. Other portable pumps, hand pumps, they're really inexpensive. They can go in your bag. You can bring those with you anywhere, and they don't need to be charged or plugged in or anything like that. And then as far as pumps in general go, it's not one size fits all for the type of pump or for the size of flanges. So really seeing somebody about how to use your pump, how to fit your pump, and making sure that everything is functioning correctly. You want to make sure that the suction is strong enough, but not so strong that it's hurting you, and that everything fits correctly.
Yeah, and I was going to say too, bringing your pump and supplies to your visit can be very helpful, especially postpartum. We see our patients multiple times postpartum, and so you might not be pumping at that 2-week visit, but one of the things that we love to do is a pumping schedule or going back to work, because most of us have to go back to work after 6 to 12 weeks. And so or pump sizes so that we can help you, because it's really hard to do it by yourself.
Yeah, that's a good point. Okay, so we do have a live question that came in the chat that I think is a good one. How do you handle, and I'll let you decide who wants to take this one. How do you handle if one breast is producing more? Is there a way to have the breast that produces less catch up maybe?
That is a good question.
Yeah, it's very natural. Our bodies are not symmetric, and almost everybody has some asymmetry in the amount of milk each breast produces. And for some people, it's pretty significant. Doing those things we talked about for milk supply before, like increasing expression of milk, making sure you're well hydrated, sleeping, those sorts of things can help. And especially if it's one side you're trying to increase, just pumping that side. But also when we look at milk supply, we look at total. So there are some people who produce drops out of one breast and have a full supply on the other, and that's okay. So really just focusing on the total output and making sure that that is adequate for feeding your baby.
Okay, let's get back to some of these pre-submitted questions that we have. This is another one about pumping. Okay, so many of us have heard the phrase pumping and dumping. When would you recommend that, and what are some common misconceptions there?
I almost never recommend pumping and dumping. There's a lot of different times where I've heard that certain medications, alcohol use, imaging studies. If somebody tells you to pump and dump, you should always verify that that's the correct recommendation. At USF, your OB or midwife can be a source to verify, because a lot of times people will tell you that just to be safe, not realizing the harm that that can do. When you pump and dump, that's a feed that your baby doesn't get. That is maybe a loss of milk extraction, and it can lead to a spiral that can really interrupt breastfeeding.
Yeah, I want to reiterate, like, especially with imaging, like ask, just shoot your OB-GYN or a midwife message through the online portal, because it can lead to a spiral of things if you do pump and dump when you don't need to.
Okay, we have a question about milk storage next. Amy, you want to take this one? This is what's your advice on best practices for that, for milk storage?
Yeah, for sure. So depending on what resource you look at, the timeframes might differ slightly, but according to the CDC, the recommendation for safe storage is 4 hours at room temperature. So that could mean if you are using a Haka, which is a type of like hand pump on one side, and you're breastfeeding on the other, if you just put it on the table, you can leave that out for 4 hours. That is safe. Or if you're putting it into, a milk bag and then you get distracted by your other kids, totally fine. So 4 hours room temperature, and then 4 days in the fridge, and then 6 to 12 months in a freezer, depending on kind of what type of freezer. I always do try and tell people to try and lay the milk. If you're going to use the bags flat, it's an easier way to store your milk. And then also kind of towards the back, ideally not on the door, just because that's being open and closed more often. So 4 hours room temp, 4 days in the fridge, and then 6 to 12 months. And then also there's a lot of really cool milk sterilizers now on the market that you don't need at all, but they can save you time if you're going to be pumping and using pump parts and bottles and all of that. And it can take the stress away from new parents of knowing if they're cleaning their pump stuff well. And so I do kind of recommend looking into some of those sterilizers because those can be really helpful.
Okay, we have one more question to get to, but I want to remind people who are watching live, if you do have a question or a comment, leave it in the comment section of YouTube or Facebook. And I want to give everybody a chance to ask their questions to these wonderful medical professionals before we finish the stream. But we'll get to this last question here. Dr. Godcharles, if you want to take this one, what are some common causes of nipple pain, and what do you recommend for women that are having this pain?
So there are a number of things that could cause nipple pain. Early postpartum, it is frequently due to latch issues, and we talked about how to address latch issues earlier. Definitely taking your baby and seeing somebody who can assess the latch. It's also not uncommon to have vasospasms of the nipple or nerve pain in the nipple that can be treated sometimes with supportive measures, but a lot of times needs medication for relief. Milk blisters can form on the nipples and cause a lot of pain, and those can sometimes be managed supportively, but also sometimes require medication. Another thing I see frequently is rashes on the nipples, whether it's eczema or a rash from some of the ointments and creams people put on their nipples. So really being careful what you're putting on and avoiding most things and just keeping things sort of clean and dry. One thing that is very common is that I get patients in my office who have been told that they probably have yeast on their nipples. And this is a big misconception. Most of the data we have suggests that yeast doesn't really grow on nipples. And so a lot of the times we're treating patients for yeast, and then their pain is either not getting better or getting worse because some of the treatments we do then irritate the nipples. So if you have nipple pain and it's not getting better with reasonable measures of ice or heat and rest, definitely see a lactation consultant, a breastfeeding medicine doctor, midwife to be assessed.
Great, thank you. Okay, so during your answer, we have a comment and 2 questions to get to.
Perfect.
So the comment is, love this, such great information. So again, just another kudos from the audience there. We have a question that talks about nervous moms. And it starts off that says, thank you to Amy for saving me on my breastfeeding journey. She's fantastic. And she goes on to ask, what advice do you have to new nervous moms who get in their head about positioning, feeding the right way?
There's no right way to breastfeed. That's the thing. But I always do validate, like it's hard. Being a new mom is hard. There's so many new things and breastfeeding's hard. But it doesn't have to be impossible because there's support and there's help. I would say with positioning, just figure out what works for you and your baby. And everyone's going to be different. Everyone's breasts are different. Everyone's baby's mouths are different. So what might work for one baby doesn't work for the next. I do recommend switching positions though. Babies do, they prefer one side or the other, or they prefer one position over the other for sure. But at least in the early stages, I recommend changing positions just so that the baby can get used to feeding in different positions and emptying the breast in different positions. I'm a huge fan of side lying. I have my patients do it when they come in to my clinic. I'll put the table down and help that, like show them how to do that. But yeah, I think there's no right way to do it. So, and ask for help always.
Always, right? Okay, so our other live question that we got is a follow-up to the milk storage question. So she says, some sources say that you can keep milk in the fridge for up to 7 days. Is that milk less safe? And if so, are there symptoms in the baby that we should look out for?
What do you think?
It definitely depends on what source you look at, what it says. Generally, milk is probably safe in the fridge for up to 7 days. There are a lot of components in the milk that keep it from being relatively safe and not promoting a ton of growth of bacteria. Generally, the milk will smell sour if it's bad. And so that's the best way to tell. The baby may show signs of GI upset, like spitting up or seem colicky or something like that. But babies also can sometimes just have those symptoms because their GI systems are immature. And so don't get in your head about that. But definitely if it smells okay, it is probably okay. I wouldn't really push it past 7 days. And if you have milk that you think has been in the fridge too long or been on the counter too long or been in the freezer too long, there are other options for it besides feeding it to your baby that are totally safe, like milk baths and milk jewelry and things like that. So it doesn't have to go to waste.
So true.
Okay. We have another comment that this is so helpful. So a lot of people are really loving all the information that you've shared. So thank you all so much for tuning in, and thank you, Amy and Dr. Godcharles, for your insight and answers today. Just so much important information that everybody has really enjoyed on this stream. Oh wait, we have one more question. So let's hold the phone on this.
Okay.
Can you touch on overproduction, providing maybe reassurance or giving tips for management?
Yes. So many things come to my head. What do you think, Dr. Godcharles?
So yeah, overproduction can be just as much, if not more, of an issue than underproduction.
Yeah.
Really, the best production is just enough production, but our society glamorizes overproduction. It definitely can increase the risk of things like mastitis and latching issues and feeding at the breast issues and abscesses. And so if somebody does have a significant overproduction, we should try to wean some to get them to a point where they're making what their baby needs. Sometimes that is block feeding, where you feed on only one breast per feed. Sometimes if that's somebody who's pumping, you pump just a little less throughout the day. And sometimes it requires herbs or medications to help downregulate the supply. But definitely is something that should be addressed and that we're also always here to help with.
Great answer.
All right. We'll end on that. I don't think we have any more that are popping into the live chat. But once again, thank you so much, Dr. Godcharles and Amy, for all of your insight and answers. And thank you again, everyone, for watching the stream today. If you want to know more about breastfeeding or our Women's Institute resources at Tampa General Hospital and USF Health, please visit the web address on your screen, use the QR code or the contact information that is also on your screen. Thank you to all who have joined live and those who have tuned in afterwards on demand. We look forward to seeing you on the next Ask an Expert, a live Q&A presented by Tampa General Hospital and USF Health. Have a great evening.